who I am. Basically, I will brief you about me. I am Mrigank. I am a final year math student in India, and during my first year only, I got approved by ICMR STS, and my paper got awarded also from ICMR STS 2023. So in this video, I'm gonna tell you how I made it till ICMR STS. So the first thing that you have to make sure you do is just keep it simple, because ICMR is not asking you for a paper that will win you a Nobel Prize. They're asking you to think like an undergrad. Keep it simple, a simple paper that is relevant, that is feasible, and that can be completed in a that 2 months of time period that ICMR is providing to you. Okay, so the sample size and everything should be restricted to that time period, and your paper design should be as simple as possible. Now we'll come to what paper design actually means. First of all, you should do observational studies. Now in that observational study, the first thing that I want to say is try to do cross-sectional studies. So what is cross-sectional studies? For example, I will explain you in a very simple term. There is a group of 500 people. What you will do is, like, you will just click a photo of that 500 people, and after that you will analyze how many people are wearing blue t-shirt, how many people are wearing white t-shirts. Then you will analyze and tell it, okay, these many people are wearing blue t-shirt, these many people are wearing white t-shirt, and what is the percentage, and all those things you will analyze it. So that is a cross-sectional study. It is the first preference is cross-sectional studies. So if you are not doing cross-sectional studies, the second thing is you can do retrospective study. So my study paper was a retrospective study where we were analyzing the correlation between iron profile and hematological parameter in CKD patients. So what is retrospective study? Basically, you just think it's a digging behind the time. So what I mean by digging behind the times, first of all, you just have to dig into the hospital records, and you have to find the data of the patients. The retrospective study is the easiest studies because it won't take you a lot of time, and it is very easy to do, less expensive, because you are not spending anything from your side. It is the reports and everything are already done. You are just taking them and you are analyzing it. So there are two types of studies. One is retrospective, one is prospective. Prospectives are very expensive, long, they are very time consuming and all. So try to stick to retrospective studies where hospital records and everything are ready to with you, and you are just analyzing them. Next thing is questionnaire basis. Questionnaire studies are pretty good because in that study what you do is, basically, for example, you are taking a area where the malaria is endemic or dengue is endemic. So you are asking people, do they know about asking people about their awareness about that disease. For example, when it comes to dengue, what they know about dengue, what type of mosquito cause dengue, how they can prevent dengue, and all those things. Do people know or not? So you are making a simple Google form, you are asking people and filling that Google form, and it is a questionnaire basis studies, and it is very simple. After that, when it comes to the main part of your study is when you are trying to start an ICMR paper or any research paper, the main thing is ethical approval. When as soon as you are submitting your as soon as the ICMR notification comes, you can just check in ICMR STS. The website will be like, there will be a separate website for ICMR STS, and you just have to click and check it timely basis, like when they're releasing notification. So as soon as the ICMR release the notification of their upcoming STS program, so you have to start working on your ethical approval. So you have to visit your mentor and say that, ma'am, sir, I want to work on that topic, and you have to discuss with your mentor regarding which topic you guys, both your mentor and you, want to work. And I guess ICMR ST is now taking only mentors above assistant professor or at the level of assistant professor only. They are not taking SRs and all. So you have to contact your assistant professor of any department or associate professor or professor. Then only you can take them as mentor and start the ICMR STS. So as soon as the notification release, the first thing you have to discuss with your mentor regarding topic, and then you directly have to go to your institutional ethical committee, that is called IC, and get the ethical approval, because ethical approvals is the main thing in any research program. So you have to do it as soon as possible, because it takes a time period of around 1 month or 3 weeks. After that, now coming to the sample size, When we come to the sample size, the main thing is you have to keep remember that ICMR is giving you a fixed time period. The time when I submitted my ICMR, they are giving like 1 year time period. You have to do 2 months. That's it, 2 months for data collection, analysis and everything, and you have to submit it. Now the ICMR has little bit changed it, that if you are applying in first year, that you have to time period till your 4th year to submit everything. But still they consider that in that time period also you only have to collect data and analyze it during your holidays, so you can take it around total roughly around 2 months to 3 months. Okay, so your sample size should be according to that. The sample size should be preferably less than 100. So my sample size during my time period was 82, so you should keep in account that your sample size should be less than 100, so that it is feasible for you to collect the sample, at the same time analyze it and make the report. After that, you have to mention which statistical software you are using. I was using SPSS version 25, so you have to mention statistical software because it plays a very important role in your manuscript, or I can say not manuscript, basically your proposal. After that, you have to take account of inclusion and exclusion criteria. Like for example, when I was doing CKD, I take account of less than I excluded people less than 20 years and more than 70 years. So you should take into account of, for example, if you are doing of dengue, then you should take that, okay, I am just doing my report on awareness of dengue in females or in pregnant females or something like that. Then you should have a particular inclusion criteria, like this group of people only I am taking into account, and remaining all the people I am not taking into account. These both things should be very specified. After that, what actually matters, ICMR always want you to take into account of diseases that are relevant for public health. For example, in India diabetic cases are a lot, so you have to take into if your paper is on diabetic, for example my one is there is a correlation between diabetic and non-diabetic group also in my paper. So when you are taking into account of the prevalence of diseases that is high in India, for example diabetes, hypertension, nowadays mental health issues are a lot, so if you are taking account into those diseases, then it is very likely that ICMR will accept your paper. So at the last, I just want to say it, just keep the paper simple, take the account of diseases that are relevant to in Indian scenario, or whose prevalence is very high in Indian scenario, and always take a sample size less than 100 and make it as simple as possible, so that just think like an undergrad. Don't think like your paper is gonna win you Nobel Prize. Just keep it simple. The golden rule of ICMR STS is just keep it simple.